Worldwide, the number of new cancer cases has more than doubled in the last 30 years. About 18 million new cases and 10 million deaths are recorded per year, an increase of almost 100% since 1990. So what's behind these numbers? What's the reason? Should we be concerned? Hi, I'm Manfred Stapff. Welcome to the real-world evidence perspective, which gives you truth, data, and candid content. Indeed, the numbers showing a dramatic increase in global cancer cases are concerning. 10 million cancer deaths per year and a 70% increase look like a global crisis. Just to give you a perspective and compare the death numbers, in 2020, it was estimated that COVID was responsible for approximately 2 to 3 million deaths. For cancer, now we have 10 million deaths globally per year. So we may assume, rightfully blame environmental factors, unhealthy lifestyle, tobacco use, bad eating habits, unhealthy diet, processed food, alcohol consumption. So it's always a good idea to care about a healthy lifestyle. But is it enough to fully explain the problem? Remember, in order to understand an issue, you need to look behind the data, the facts, and also at the global context to make a reasonable decision and have a reasonable fact-based opinion. So let's try this. Whenever absolute numbers of diseases increase, then it makes sense to look at the overall population. Here, the absolute increase of cancer cases is primarily driven by population growth and by aging of the population. We see a 55% increase of world population since 1990, and we live about 2 years longer now in the year 2025 than we had a life expectancy globally in 1990. So this explains the overall growth of cancer numbers. So now we have to look a little bit more into the specifics. If statisticians correct for age and calculate the incidence per population, they even find a slight decrease, a 5% reduction in cancer and mortality rates. So it's mainly driven by population growth and not that cancer itself overall is increasing so much. So overall, earlier diagnosis, better treatment options, they contribute to the numbers slightly. So let's look a little bit more into the details. So what types of cancer are we talking about? It turns out that breast cancer is responsible for the most cases, the most frequent cancer. And lung cancer is responsible for the most deaths. There are differences by geography. The incidence and the mortality increased, especially in low and middle income countries. And it's estimated that in most countries, about 20% of cancer-related deaths are due to smoking. However, in low-income countries, unprotected sex carries the greatest risk because it can transmit human papillomavirus, which can cause cervical cancer. Based on this data, one assumes that about 40% of cancer deaths may be preventable or avoidable by behavioral or lifestyle changes. A big change since 1990 is seen for hepatocellular carcinoma, so-called liver cancer. The cancer cases increased by 100%, this is doubling the number of cases since 1990. And this can be explained, as we said earlier, by population growth and by aging. However, there is a shift in the causes and the reasons for liver cancer from virus hepatitis in the 1990s, now to alcohol and to metabolic syndrome, what we now call MASH, or called a few years ago NASH, non-alcoholic steatosis hepatis, or now metabolic associated. This is associated to diabetes, obesity, high lipids, and is not 100% clear and fully understood, but is now the most frequent reason for hepatocellular carcinoma. There's another topic which we have to look at and which is very concerning. Cancer before age 50 is in general rare, but it's increasing, especially breast, colon, kidney, and uterus carcinoma, which impacts in 2/3 of the cases, obviously, women. Perhaps you also have someone in your group, friends, colleagues, family, who is impacted with a cancer diagnosis in this younger age group, and everybody is looking for answers and what is causing such early onset cancers. The causes are so far unknown, but researchers have some ideas. So genetic predisposition may be a contributor. There are tumor suppression genes like TB53 or BRCA, which help preventing the tumor from even starting to grow. Did you know that elephants never get cancer? Because elephants have 40 types of TP53 genes. We humans, we have only 2 alleles, one from the mother, one from the father. So if one of them is damaged or has a mutation, then we are weak in our defense against cancer. Elephants have 40. If one is damaged, they have 39 more. There are also genes which help repairing damages in the body, MDK for example. So these factors may play a role if there are damages or if there are mutations in these genes. The question is, however, what would be the reason for these genetic shifts? Normally, genetic changes do not happen so quickly over 30 years. So this is certainly something which needs to be explained. Then there are environmental factors, pollutants, chemicals, microplastics. There is food, obviously. Obesity is blamed, especially for colon cancer. And there is the gut microbiome, where we do not really know a lot about. Our gut is a chemical manufacturing place. Billions of bacteria create molecules and may perhaps create toxins or may create molecules which create cancer, and we do not really know a lot about it. So there's a lot to be done for research and science. Let's remember what we need to get reliable evidence. It starts with an observation. It starts with a reasonable hypothesis. Then you have to do clinical studies. We have to do meta-analysis, registries, or real-world studies. So you may know this sequence and these steps to evidence gain when you know my book, Real-World Evidence Unveiled, Navigating the Maze of Modern Misinformation. Here, for early onset cancer, we are in the area of step 2 or 3, observations, and perhaps the idea of reasonable hypothesis, but there's a lot to be done, a lot of studies, a lot of research to be done until we have real proof. So let's summarize. What have we been talking about? Population growth and increased life expectancy, together with earlier diagnosis and better treatment options, may be reasons for the overall global general increase in cancer cases worldwide. 1/3 of the cancer cases, specifically those leading to death, are preventable, talking mainly about smoking. There is a global inequality, meaning that low-income countries are in a worse shape than the so-called developed Western world. And there's a big question mark. Early onset cancer, cancers in people younger than the age of 50, that's the official definition. We do not have a lot of ideas. We have some hypotheses, we have some theories, but we do not yet know where does it come from and what changed so dramatically in the past 30 years. So here we are on a point where it really helps to learn a little bit more about the 7 stages of evidence, how we can generate a robust opinion by looking behind data, facts, and differentiate misinformation, disinformation, fake news, and real news. And this is available in my newest book, Real-World Evidence Unveiled, Navigating the Maze of Modern Misinformation. You can get it as an ebook, paperback, or hardcover on Amazon. I hope this short overview gave you a quick update about this topic and helped you to understand it better by looking at data and facts. Thank you for watching the Real-World Evidence Perspective, which brings you truth, data, and candid context. Don't forget to like, forward, comment, or subscribe to this podcast, whatever you find appropriate. Thank you very much.